Hi, everyone. Welcome back. My name is Jason Goodchild from Premier Dental, and today I'm sitting with Dr. Tim Bizga, and I've asked him to walk us through one of the cases that he sent me, a clinical case. A little bit of backstory. When Premier Dental was ready to launch our new self-adhesive resin cement called ZR-SEM, I reached out to several KOLs to try the new cement and give me some feedback. And if possible, I kind of begged them to send me some photographs of a clinical case to help with the education, show me how it was working, and then maybe be able to incorporate some of that stuff into some educational programs. And lo and behold, Dr. Tim Bizga actually obliged and sent me some fantastic photographs. So that's the point of this short video today, is to look at the photographs and walk through the case to understand the whys. Why did Dr. Bizga do some of the things he did in this case to ensure success? And then ultimately, from an educational standpoint, why did he take the photos that he took? What was he trying to show us that was so important? With that, let's jump in. Tim, thanks for doing this.
Good to be with you, Jason.
All right, man. So tooth number 30, and looks kind of short. Tell me how you prepped it, why you prepped it that way.
So let me give you a little more backstory, because this is a remake of a prep that I did probably a year or two out of dental school. And the porcelain that I did on this crown ended up fracturing. And probably because I under-reduced. Probably one of the things you see, I know your background in education and being in dental schools, as I've been, most students and graduates early on, and even dentists in their first, I'd say 5 to 7 years, one of the things that they suffer from is being too conservative with their preparations, even access openings and prep designs and different things. And I felt guilty of this as well. And so years later, the porcelain fractures, and we're remaking it in order to get the space that the lab requires. Now I'm violating some of our prosthodontic principles that we remember so near and dear, which is all preparations minimum height requirement to retain a crown is 3 millimeters, with the exception of molars. Molars require a minimum mesial and distal wall height of 4 millimeters. And so clearly, after I've done my reduction and made it proper for interocclusal space and give myself enough material, I don't have 4 millimeters of mesial and distal wall height in this molar prep. So the workaround in it is proximal boxes and slots. And so as you can see in my impression and to the die that the lab provided me, I asked them to make sure, and this is one of the things, especially if you're sending to a commercial lab, you need to make sure you indicate on your lab scripts, do not block these out. Sometimes in the speed of production, they don't realize that those slot retentions are there to increase retentive form and in resistance form, which is really what's keeping the crown on. It's about resistance, the stresses, the lateral forces of chewing. And so I've got one here, the belt and suspenders approach. I have a mesial and a distal walled in preparation, a little slot retention, and I've asked that to be reproduced in the intaglio of the crown. So that was my thought process behind it. This is getting to remake it and make it right.
Yeah, and I know that from seeing some of your work in previous examples, you could actually go a bit further and you've added the mesial and distal, you could add the buccal and lingual as well and make it almost like a puzzle piece that fit in there. But, I think in this one, you probably have, 3 millimeters. So it's not tremendously short, but, that belt and suspenders approach, I think, is a good one for this case.
Yep, that was my thought process.
Yeah, so let's move on to the next one. And so you take a nice impression, send it off to the lab, get back a beautiful, this is a full contour zirconia?
This is actually a katana zirconia. So it is full contour, but this is more of that newer family of zirconias that were coming out that are more aesthetic. Mm-hmm. And certainly there's some extrinsic staining that's happened to sort of jazz this up and help it to blend in with the surrounding structures. The lab technician did a fantastic job. But the key really for me is what's on the inside, which is what the intaglio surface here, they've reproduced my mesial and distal slots. And that way I get that lock and key, or that old-fashioned staple preparation like we learned from GV Black, right, with our amalgams, that nice staple effect that you get. And that's really what I was going for. And now the real thing is that what's holding this crown on is the prep itself. And so what simplifies now is my process of cement selection. But as you indicated, you had sent me something to get my eyes on. And to be fair, I typically would use a resin modified glass ionomer, or I would use a bioceramic typically to cement posterior zirconia crowns. But I was going for the effect of, I'm going to try this out. Seems very promising from all the things that you gave me. And so here we are. We're going to go ahead and bond this on with your new ZR Sem, which is a self-etched dual cure resin cement that is designed to, as you told me, work wonderfully well with zirconia and to give you that extra retention. And you and I were talking off camera about some of the things that we sometimes will do to enhance the bond between our cement and zirconia. It's historically been well documented that phosphates from saliva during the try-in can get picked up to that surface, and it can make some of the receptors on the zirconia less likely to adhere to the cement. And so we can go through a process of cleansing it. And there's many cleansers out there that are available. IvaClean is probably one that people are most familiar with. Some people, you will use phosphoric acid etch. Others will use a alumina oxide air abrasion. That's sort of my go-to because nobody seems to dispute whether or not it is effective. And then treating it with some sort of MDP primer. And you have also sent me something very nice to try, which is the Premier Primer, Universal Primer. And so this surface didn't just go right from the box to try in to cement, which you certainly could do. There's certainly enough retention to take it that step. But I always like to make sure I clean the surface. So in this case, I air abraded. I used the Universal Primer, following the instructions of applying it and then air drying it. And then it was ready. And I had done my try-in, and now it's ready for us to go ahead and do the cementation.
Did you do anything to the prep? I mean, with a self-adhesive resin cement, we don't have to do a separate bonding step. But did you do any cleansing or disinfecting of the tooth?
So that's great. I have been a big fan of cleansing preparations. So for a long time, I've either been using a cavity cleanser, so something that's like a 2 to 4% chlorhexidine scrub, or something like Conceptus. I will clean all, because, you know, let's be honest, when you retrieve a temporary that's been in somebody's mouth for 2 weeks, what's the usual odor that comes from underneath that temporary? I often describe it as dead bird. If you've ever had a dead bird in the yard, it has that odor that you go, something's rotting. And that's sort of the smell that's under crowns on occasion. Not all the time, but you know that there's leakage. And depending on, you know, the situation and the depth of the prep and how cleansable, and if the patient followed instructions, it can be a little nasty in there. And so when they taste it, especially, and they sometimes will get that, you know, taste when you remove the temporary, I always like to remind them that I'm going to disinfect the preparation before I put the crown into their mouth with the final cement. So yes, I typically will go through some disinfection of the preparation, and got to make sure all the temp cement's off, correct? Before you go in. So I always clean the temp cement and then go through some sort of disinfection. And I like to usually announce it out loud to the patient so they know I'm disinfecting the tooth. I just think it gives them that warm, feel-good feeling.
Yeah, yeah. I think the take home, I think, for a lot of these is, you know, when you think about cementation protocols, you know, the devil's in the details. So it's not just like you said, pull that crown out of the box, put the cement in, and seat it on the tooth. There's some little things that we can do along the way to really help us out. Disinfecting the tooth, treating the intaglio, whether it's a zirconia crown with air abrasion or a glass ceramic crown with hydrofluoric acid or silane. I mean, there's some things we need to do just based on substrate. All right, let's move on. So here you go. This is the ZR-Sem cement, and I love what you got here in terms of these learning pictures, because from a clinical standpoint, I don't think we need to necessarily see the bleeding process, but why'd you get these ones?
Well, I think it's a reminder for the assistant. So it's good to double bleed, right? Make sure that the paste cements, which I love for their convenience, but we have to make sure that the mix is not only coming out of the barrels in an even proportion, but we have to make sure that the first bit out of the mixing tip we discard, because that's the most inaccurate portion of the mix. And it's just a reminder to everybody who's utilizing the first, make sure that you got even distribution of the paste coming out. And when you put your mixing tip on, go ahead and express when you're ready to cement, but don't put the first amount right into the crown. Yeah. It could lead to uneven set times or low bond strengths or, some issues. So it's just a good reminder. Sometimes it's just good to go over the basics.
Yeah, I agree. And I like that you used a little barrier sleeve on the cement. It's the sleeve it barrier. The reason I love these little barriers is because for equipment, supplies, whatever that can't be sterilized, creating a barrier so that we can handle them in a clinical environment, but not, infect them or get all those germs all over them. And then how do you get those things clean if we're going to use it on another patient? So we've typically wiped them, but I think that barrier sleeve is a nice extra little step. Okay, so here we go. That's your hand, I'm guessing, and you've got that crown full of cement. Any pearls here?
Well, it's just making sure that you have enough cement that you're going to get an even smush out around. I like to make sure that you get that nice little ripple that comes out, and that way you don't leave any portions of the margin dry. So I like to always make sure that I fill it so that I have a positive amount of cement. When you're seating on natural teeth, you want to make sure you have an even, nice wrapping of the cement all the way around, and that way you have a good seal.
Yeah, I'm right with you. And sometimes actually, I don't know if you're like me, but I think we're saying the same thing, but with resin cement, because historically they can be challenging to clean up clinically in the posteriors, I would add just a little extra of that versus just the little bit, not too much. Because I want to have that roll of cement around it, not only to make sure I got all the margins, but also it'll make it a little easier to clean up, I always think.
Yes, and it's really not as much a science as it is an art of how much to fill it. Yeah. And so you got to use your best judgment, and I just like to fill it all the way up and make sure I have a nice ripple amount, but certainly you can overfill, so you got to sort of use your judgment of what you're doing and the size of the tooth and all those good things. Yeah,
and I think another good pearl probably is you got to move quick too. Once you get all that cement in there, as soon as those base and catalysts come together, that's starting to set. So, you fill it up, get it right on the tooth.
It's a good one.
And so this is the great shot I love. This is and I almost have to picture you're doing this clinically, is that, you seat the tooth, and then what do? Grab your camera, and, you've got this thing pretty well dry. And that was really a fantastic picture in the heat of the moment.
So let's talk about it. So here's how you get it. First of all, what you can sort of see in the script in the background is a dry shield, which is a bite block, cheek retractor, tongue retractor, and suction all in one. So the reason this shot was possible is because I had another set of hands, if you will, helping to keep the field extremely dry. When I did seat it, the first thing I did do, and this is just something from props principles I was taught by one of my mentors, Dr. Robin Schumacher, back when I was a baby dentist in school, that hydraulic forces of the cement will push against your pushing the crown down for approximately 15 seconds. That's what I was taught. And so what I did first is I held the crown down for 15 seconds. The reason being is if I, just took my hand off after seating and got the shot, there's a good chance that crown could float up slightly and move from hydraulic lift forces. So just to make sure that I've overcome them, I went ahead and held for 15 seconds and then did a little light tack cure around, which I believe we have a photo of that as well.
Yep.
And then we captured the shots. And that way we know that we're not jeopardizing it. It's a great shot. I didn't realize how good it would be until, you go back and process, because it is kind of cool catching it in the moment. But there was a little work that went in beforehand. So it wasn't just seat it, snap the photo. That's what made it work.
Yeah, and then you talked about this one, which is the idea that the tack. And how long are you tacking that for?
So I went ahead and here's the rub. It depends on your curing light. So I have been in a position where I have recently got to demo a lot of new curing lights that have come to market. I got to tell you, it depends on the curing light. So if you have one that's a little bit lower output, you might get away with a 3 to 5 second. If you have a high intensity that's putting out, several thousand milliwatts, you might want to just tack and wave it for a second and then check it real quick. So for me, it's somewhere between 1 to 2 seconds and tack and wave. It's not holding on a spot. I caught it quickly in this moment on a spot. And in this case, we used a lower power curing light because I knew that it would initiate the gelling a little bit friendlier than a high intensity. So I like to finish my cures with a high intensity, but when I'm doing a tack and wave, I have a lower intensity curing light that's a little better for gelling cement.
Yeah, the last picture was fantastic. This is even better. It really tells a story about, the idea of, there's two ways to do this, right? You could use no light and let it just gel on its own after around 90 seconds, but to speed things up is to, do a tack and wave kind of thing. And I think you're spot on. If you, nothing's worse than doing too much tack curing and then have that roll of cement being rock hard and trying to get that off there, but just the right amount. And then, we keep talking about, hey, the last picture was great. This picture really tells a story, but to me, this next one is just as good as it gets. And right there, I think you even called me about this and said, hey, wow, I can't tell you how happy I am with the way this cement cleaned up. And so what's going on here?
So initially what I always do when I'm evaluating a cement, and so I took these photos because I wanted to document this because you requested, and I was also evaluating at the same time. So typically what I do is I will check the tacking, and what I noticed is once I had it tacked and I started to just, go along the buckle margin, it was peeling in one continuous smooth piece. And I've never really had that happen. And I've been a part of a lot of evaluations, and it is so relative, and it's such a difficult question. But when they ask the end user, how easy was the cleanup? I suppose that my mindset has always been, well, if I was able to get it cleaned up, it was pretty easy. That's sort of how I've always framed it, because easy is so relative. What's easy for me may not be easy for you. An extraction that I see as easy may not be easy for somebody who doesn't enjoy doing extractions as much. So I always see it as relative. But this was truly the easiest cleanup, and so much so that it got me to try this again. And then when I did it again, one of the things I'm a big golf fanatic, and I love Tiger Woods and some of the background stories. And one of the things early on in Tiger's career, when his father was around and he was mentoring him and coaching him, and I heard this story, is when Tiger would hit a great shot, his father wouldn't say great shot. He would say do it again. And I thought that was really cool because greatness can repeat itself. So I didn't know if I got lucky the first time, but this photo actually provoked me to try this product again. And when I tried it again and I got the exact same results, I have been continuously using this, and it's become one of my go-to cements. And because it truly, when I need the bond, or I have a great field and I can get that extra, I know that I'm going to have an easy time cleaning it up, especially in the posterior, which is the place people are so afraid to use the resin cement, and which is why I opened up by saying to you, to be fair, I typically don't use a resin cement for posterior crowns. And it's really because I've been leery of the cleanup. If your assistant's having a bad day and over tack cures, right? Now you're getting a seri saw or something out to hack open a margin and contact. And that is just not a fun way to start your day.
Yeah, I couldn't agree more. I mean, nothing can ruin that would be easy delivery visit than having to take off resin with a diamond burr or a seri saw interproximally. So I'm totally with you. RMGIs and so forth, they're pretty darn easy. If we could get a resin to be that easy and get all the benefits of resin, that was really the goal. And at least right here, it looks like we got pretty close to that goal. The next one is really a cool photo too, because I see what you did there. Like, you put the two pieces together on a mirror there and took another photo.
Yeah. So it peeled in two perfect pieces and came right out. And then I just set them together and I go, this is amazing. Cause in sincerity, I have worked with a lot of products in my near 15 years of private practice. I've had the privilege of evaluating a lot of things. I have never seen one that comes apart in two pieces every time. So when you work with this, I mean, there's an occasion, right, where you'll maybe sever a piece and it'll come out in three pieces, but it comes out this easy time and time again. And that's what I love. I took a photo because this is something like a unicorn. I thought you may never see this again. And I've been proven wrong. This has really been a cement that when you have that easy to clean up, but with all the benefits that you want out of resin, this ticks the box. Yeah,
no, I'm totally with you. And I think that when it comes to any of the products we use on a day-to-day basis, because I often think of cementation as kind of a high risk procedure. Not risk because it's dangerous or anything, but it's like you only get really one shot at doing it right. And so you really want to have confidence in the stuff that you're going to be using, and having something that kind of gives you that nice tack window and easy cleanup. For resin, I can understand why ZRSEM has been so popular. So I appreciate that. So last photos as we wrap it up. Beautiful crown in the mouth.
That's right. Immediate post-op, right? So the lab technician did a fantastic job, and crown is doing great. And what can I say more than that?
Yeah.
This is a happy day. This is when the crown goes in and there's two snap floss contacts and the cementation process goes well. And then you're able to get some nice photos to be able to share it with others and say, look, if I can do it, you can do it, and share some information and some knowledge. It's a good day.
Yeah, I'm right with you. These things. Well, with Crown and Bridge, I often think that a lot of the work is done on the front end. The back end should be easy because we've done a nice prep, made a nice impression. Lab's done a great job. This should be easy, and we certainly don't want the cement to be that fly in the ointment. So it really turned out well, I think.
Well, thank you.
Yeah. Well, Tim, Dr. Bizga, I really appreciate you taking the time to share this awesome case with us, and look forward to sending you more stuff to get awesome photos.
Appreciate it. Anytime.
Thanks, man.
You bet.